This is Group 2's presentation on cancer.
Hello, my name is Amy Aviles, and I will be presenting a slide on how does cancer develop. Cancer is a disease caused by uncontrolled cell division. Cancer develops when the body's normal control mechanism no longer works, causing old cells to grow out of control instead of die, which is a normal part of the cell cycle. This division causes new abnormal cells, causing tumors or lumps. The uncontrolled growth can sometimes lead to the spread to surrounding tissues, which is also known as malignant tumors. Benign tumors are non-cancerous and can be removed. If cancer is able to spread through the bloodstream or the lymph system, it is known as metastasis. There are 5 main categories of cancer. Carcinomas begin in the skin or tissue that line the internal organ. Sarcomas develop in the bone, cartilage, fat, muscle, or other connective tissues. Leukemia, it begins in the blood and the bone marrow. Lymphomas begin in the immune system, and central nervous system cancers develop in the brain and the spinal cord.
Breast cancer is a cancer that forms in the cells of the breast. Breast cancer usually is seen in women, but it can happen in men as well. Symptoms of breast cancer includes lumps in the breast or around the breast, bloody discharge from the nipple, and changes in the shape or texture of the nipple or the breast. Treatments depend on the stage of cancer, and it may consist of chemotherapy, radiation, and surgery. Some specialists that treat breast cancer are usually oncologist or radiation oncologist. Leukemia is a cancer of blood-forming tissue, hindering the body's ability to fight infection. Leukemia is cancer of blood-forming tissue, including bone marrow. Many people with leukemia don't have symptoms for slow-growing types of leukemias, but for rapidly growing types of leukemias, many patients experience fatigue, weight loss, frequent infections, and easy bleeding or bruising. For aggressive leukemias, treatments include chemotherapy that's sometimes followed by radiation and stem cell transplant.
The stages of cancer. Stages of cancer is a way to describe how big the cancer, how far it has grown and spread to the nearby tissues. And for most type of cancer, there are 4 stages. There are no cancer for stage 0, but only abnormal cells with the potential to become cancer. It is often referred as a carcinoma in situ. Stage 1, the early stage of cancer, it is only affected in one area where it started in. Stage 2, stage 3, the cancer is present and has become larger and grown into a nearby tissue or lymph nodes. Stage 4 means the cancer has just spread to the other parts of your body organ, also called metastatic cancer. And for most cancer staging, they use some form of DNM system, and most doctors use this to help provide them information to the person's cancer. And the DNM system uses results from tests like scans and X-rays and biopsy and other tests. And by the way, TNM acronym stands for tumor nodes in metastasis. And that's it for me, Shintaro Carbonella.
Hello, Professor Otero. I'm here to discuss the treatments for cancer for you. There's 3 different treatments. Main treatment: surgery, chemotherapy, and radiation. Surgery is the removal of the big tumors. They don't necessarily remove all of them, they remove some of it. There's high risk of pain and infection post-surgery. And there's preparation needed, such as blood tests, chest x-rays, and electrocardiograms. Chemotherapy is used for most cancers, but not all of them. They're given through IVs and pills. There are certain side effects, such as feeling sick, weight loss, and hair loss. And it can affect other organs. Radiation is a form of treatment. It treats little cancers. There's internal and external. The internal is injected inside of you, and the external is a big X-ray machine that circles around your whole entire body, creating radiation throughout your body. The side effects are skin changes, dryness, blistering, and fatigue.